All right, this is the first that we were hearing from the Memphis police after Trump announced the National Guard is headed there. But we do have that Governor Stein press conference. It looks like it's getting started. That is about the COVID-19 vaccines. Let's take a listen, see if it's getting started.
Thank all of you for joining us today as we take action to protect public health in North Carolina. As temperatures drop and with fall right around the corner, it's the time of year when many people want to take action to protect themselves from viruses. However, there's a lot of uncertainty right now about who can get the COVID-19 vaccine and who will be able to afford it. If you do not want a COVID vaccine, don't get one. But if you want a COVID vaccine and the FDA recommends, you should be able to get it. Right now, North Carolina is one of only a handful of states where people must get a prescription before they can get a shot at the pharmacy. This is unnecessary red tape, and it's time for North Carolina to get in line with other states across the country. That's why I am taking action to protect COVID-19 vaccine access for North Carolinians who'd like to get it, just like Virginia did 2 days ago. I've directed DHHS State Health Director, Dr. Larry Greenblatt, to issue standing orders if he agreed in his medical judgment. Dr. Greenblatt has issued these orders, which allows pharmacies statewide to provide COVID-19 vaccines to senior citizens, as well as adults over 18 who meet the CDC's list of high-risk conditions without having to get a patient-specific prescription. The Food and Drug Administration approved the next round of COVID-19 vaccines in late August, and the standing order aligns with those federal recommendations. These actions will help protect healthcare access for people all across North Carolina. Again, this is about choice. It is not a mandate. We want you to have options to protect yourself, your loved ones, and your neighbors. Vaccines are one of the most effective tools we have to prevent serious illness, hospitalization, and death from COVID-19. They help protect not only the beneficiary, but everyone from the spread of infectious diseases. I encourage people to talk with their healthcare provider about the benefits of vaccines, as well as any concerns they may have. This season, let's stay healthy and let's keep our friends and family healthy too. Thank you, and I'll turn it over to Secretary Dr. Sangbai.
Thank you, Governor, for those opening remarks and for your leadership as we work together to make North Carolina healthier and stronger. The order issued today will serve as a COVID-19 vaccine prescription for people who choose to get the vaccine and who are 65 and older, and adults 18 to 64 who have certain health conditions that put them at high risk. I know there's been a lot of confusion among people looking to get the vaccine in the recent weeks, and this order should help make things easier for adults who want to get the COVID-19 vaccine. The order is necessary this year because, as you've just heard, per state law, immunizing pharmacists in North Carolina are only permitted to administer vaccines the Advisory Committee on Immunization Practices, or ACIP, recommends. However, this year, ACIP has not given its recommendations for COVID-19. Without these recommendations, and prior to the standing order, pharmacists could only administer the vaccine with the prescription from a provider. Requiring an office visit to obtain a prescription to receive the vaccine at this critical access point is an unnecessary barrier to the health and well-being of North Carolinians. We know that 70% of people in North Carolina receive their COVID-19 vaccines at a pharmacy. Vaccinations against seasonal respiratory viruses, including flu, RSV, and COVID-19, are especially important for people who are at higher risk of severe viral respiratory disease. Vaccines are one of the most effective means available to prevent serious illness, hospitalization, and death. They help protect the health of children and adults, their families, and the entire community from the spread of infectious disease. I'm going to now turn things over to Dr. Larry Greenblatt, our State Health Director and Chief Medical Officer, who will talk specifically about the orders he just signed. Dr. Greenblatt?
Good afternoon, everyone, and thank you, Secretary Sangbai and Governor Stein. The order signed today will go into effect immediately, so people who want a COVID-19 vaccine and fall within one of the approved categories recommended by the FDA and CDC can get their vaccines this weekend if they choose. The order stands in place of a prescription for people who are 65 and older, and also for adults 18 and older who have at least one high-risk condition. The list of high-risk conditions is very broad and includes obesity, asthma, diabetes, physical inactivity, depression, former or current smoking, and pregnancy, among many others. ACIP recommendations are expected later this September, and federal guidance may continue to evolve. As this happens, North Carolina will do everything it can to ensure people have access to safe and affordable COVID-19 vaccines. This new standing order is part of our ongoing effort to make COVID-19 vaccines more accessible and help protect North Carolinians, especially as we enter the fall and winter virus season. Individuals, including parents, should talk to their healthcare provider or their children's healthcare provider about the benefits and any concerns they have regarding seasonal vaccines, including the COVID-19 vaccine. I'll now turn it over to Dr. Kelly Kimple, Director of the Division of Public Health.
Thank you, Dr. Greenblatt. The directive and standing order will help make it easier for people to get a COVID-19 vaccine if they want one. It also makes it easier for pharmacies and retailers. If you want to go to a pharmacy to get your COVID-19 vaccine, there are a couple things you may want to be aware of. Most pharmacies already have the updated COVID-19 vaccine available for the season. But since the seasonal vaccine formulations were recently approved by FDA, it might not yet be available at all locations. You may want to call your pharmacy ahead of time to assure they have the COVID-19 vaccine and make an appointment if one is required or preferred. Remember to bring your insurance card if you have one. And you may be asked a few simple questions about your health to confirm eligibility. Again, because of this standing order, there is no prescription or doctor's visit required. Most insurance plans cover the cost of the vaccines. Increasing access to COVID-19 vaccines for people who want them helps to ensure more North Carolinians are protected as we head into a high-risk respiratory virus season. Thank you, and I will turn it over to Bailey Pennington, who will moderate reporter questions.
Thank you, everyone. That concludes our formal remarks. So if any of our media partners on the call have questions, now would be the time. You can either put your question in the chat or raise your hand and we will call on you. Morgan Casey has our first question.
Can you hear me all right? Okay, cool. My name is Morgan Casey. I'm a local health reporter based in Fayetteville, North Carolina. Is North Carolina in any conversations with other states to form a coalition around vaccine recommendations as we've seen in the Northwest and Northeast?
I'll turn it to Secretary Sangvi.
Thank you, Morgan, for that question. We are aware that many states are in conversations to understand how to best implement immunization practices. We are currently not in any specific conversation, but are currently looking at ways that we may get involved with other states.
Thank you. We'll take our next question from Ashley Rowe.
Thank you so much. Hi, quick question for clarification. So this is for people 65 and older, and also those who are 18 years and older, who are over 18, who meet certain criteria. How is that worked out with the pharmacist? Can somebody who goes up to a pharmacist and says, "I've got diabetes" or "I have asthma," then get the vaccine without any issue?
Dr. Kimple, can you help answer that question, please?
Happy to. So they are 18 to 64 years old with certain health conditions. The pharmacy may ask certain questions or simply ask the person to attest to what are the conditions that would make them eligible. Again, there shouldn't be any medical documentation necessary to receive the vaccine.
We have a question in the chat from WUNC. What is the state doing to ensure access for people who are low income or do not have health insurance?
And Dr. Greenblatt, can I look to you to provide some clarity on what we're doing with respect to low-income individuals and individuals without health insurance?
Currently, the Medicaid program is paying for COVID vaccines for individuals who are beneficiaries, and that's based on last year's ACIP recommendations. And I don't know of any programs right now for individuals who don't have health insurance to be able to get a COVID-19 vaccine. And I'm wondering if Dr. Kimple knows, are they available at local health departments, or are there other programs for the uninsured?
So for communities and for people trying to access low-cost vaccines, I would recommend checking with your local health department in your community. Another option may be a community health center that may be in your area, again, trying to have different access points to vaccine.
Thank you. We'll go to Rose Hoban next.
Hi there. So this standing order thing, has this been done before?
So it has been done in other states, and there's a public act called the Public Readiness and Emergency Preparedness Act, which for detail is 42 USC section 247D-6D, which gives the governor the authority to request a standing order as was just requested.
Our next question is in the chat. Richard Craver asked, would this executive order, standing order, expire upon approval from ACIP recommendations next week, or would it remain in place in conjunction?
And I'm happy to answer that. It remains to be seen right now. What we don't want to do is create any further confusion for patients, providers, and pharmacists. So after ACIP meets, and if they come forth with a recommendation that then creates confusion between the ACIP recommendation and the standing order, we'll take action accordingly to limit or minimize any confusion.
Our next question asks, would members of the immigrant community be eligible to receive the vaccine if they fall within the CDC guidelines?
And Dr. Kimple, can you again talk to us a little bit about the eligibility for the vaccine?
Yeah, and this standing order really is opening up access to pharmacies as a point of convenient access for vaccine. I know there are broader conversations related to how can we increase access to all healthcare services, including vaccination. And again, if there are areas in the community, such as a local health department or a community health center, that can start to have that conversation with individuals that may be looking for that vaccine or other health services.
All right, we'll move along to our next question. Is there any state guidance for people who do not fall in the 65 or older category, do not have any of those underlying health conditions? Are they still eligible to get the vaccine?
Dr. Greenblatt, what do I do if I don't meet those CDC guidelines and I'm still interested in getting the vaccine?
Right. No, that's a great question. There are individuals who might just choose to get a COVID-19 vaccine. Those individuals would not be covered under the state standing order, and they would need to get a prescription sent from their provider to the pharmacy, and then it's available to them.
Thank you. We have another question in the chat asking about the physical inactivity as a pre-existing condition. Does that mean I can tell my pharmacist that I do not get a lot of physical activity and be eligible to receive the vaccine?
Again, I think this gets to the issue of eligibility for that 18 to 64 group. Dr. Kimple, give us a little bit clarity on what that means.
So there are individuals that are at higher risk for complications, and there's a long list, I think, as Dr. Greenblatt mentioned, which includes physical inactivity. And this list has been accepted, and there's more information on a CDC website related to that. So again, going to a pharmacy, they may ask you to say if you attest to having one of those conditions, physical inactivity being one of those, and then you would be eligible to receive the vaccine.
We also have a question about insurance coverage. Is there any chance that my insurance will not cover the shot if I am under 65?
Again, another good question. We recommend individuals, if they have a question about coverage, to contact their insurance company to ensure that they are going to be covered and the circumstances under which they may be covered.
Thank you. We'll go to Patrick Thomas for a question.
Hi there. Thank you all for holding this. There's been, as you know, a lot of discussion about this, and I've actually had a lot of my pharmacy sources express a great amount of frustration on their own. And I'm wondering a few different things, but one, so I'll use myself for example. I'm 37. If I went to a pharmacy right now, I wouldn't be able to get a shot based on the guidelines because I don't have a health condition. Do I have that correct?
That is correct. Under those circumstances, you would not meet the eligibility criteria for a 37-year-old without a qualifying health condition. The standing order would not apply, and you would have to do what Dr. Greenblatt and Dr. Kimple outlined, is to get a prescription from your provider.
Okay. Thank you, sir. And then to follow up with that, so I presume this is a standing order in place of what is or is not to come from the CDC's advisory committee on immunization practices. Is that what that is until you hear from them?
Yeah, that's correct. So right now, what this will do is it'll fill the gap between now and if ACIP takes any kind of recommendation on the COVID-19 vaccine. And at that time, we'll likely have to modify anything we do based on those recommendations. But what this allows us to do is to take action today. And I'm going to ask Dr. Kimple if she wouldn't mind sharing a little bit about what our surveillance is showing now with respect to COVID disease in the community.
Course. And I think now is a good time because we do typically see a late summer surge in COVID-19, and our surveillance is showing that we are in that time. So we wanted to ensure that we were doing everything we could to increase access to COVID-19 vaccine, even if there is a gap before the Advisory Committee on Immunization Practices. And again, the standing order is in alignment with the FDA approval that has been issued.
Thank you all.
Thank you. We have about time for just a couple more questions. We'll go to the chat first. Clayton Hinkle asks, can you talk a little bit more about how you made this decision? Were you hearing from people turned away or perhaps confused by the mixed messaging in advance of ACIP's meeting next week?
Yeah, that's a great question. And in fact, we've heard from multiple different constituents. We heard from the provider community that were getting inundated with phone calls requesting prescriptions. We heard from patients who thought they had the ability to access the vaccine at a pharmacy like they did last year, only to find out they need a prescription. And we've also heard from pharmacies who were saying that there were individuals coming to the counter requesting a COVID vaccine only to have to turn them away. So all three constituent communities have been communicating with all of us. I know Dr. Kimple has gotten those calls, Dr. Greenblatt as well. So this is really in response in large part to what the community has been asking for.
There was one more question as part of Clayton's ask. He said, as a reminder, if you had the booster last year, how important is it to get a fresh booster this year?
And that sounds like a perfect question for our State Health Director, Chief Medical Officer, Dr. Greenblatt.
Thank you. So the virus, as we've heard before, is always changing and evolving, and the what we have now in pharmacies is an updated COVID vaccine. So two issues here. One is immunity tends to decrease over time, and the other is the current vaccines have been modified, just like the flu vaccines are, to best match the current circulating strains. So I would certainly encourage those who want to be protected and definitely those who are at higher risk to go ahead and get their annual COVID shot soon.
And our final question will be from Ashley Rowe.
Thanks so much. If the ACIP does not recommend the vaccine for children, will you consider expanding the standing order to include children?
That's a great question. The important thing about this standing order is entirely based on what the FDA is allowing and what the FDA has recommending. So we'll continue to look about any modification we'll need to make, but we want to make sure that we're in accordance with federal guidelines, the FDA and the CDC.
All right. Oh, that is about all the time that we have for today. Secretary Sangbai, Dr. Greenblatt, Dr. Kimpel, thank you so much for your time and expertise today. And thank you to all of you for joining us. We really appreciate your interest in this, and please let us know if you have any follow-up questions. Thank you all.
All right, you've been listening into a press conference from Governor Josh Stein and state health officials about expanded access to the COVID-19 vaccine. They wanted to clear up some misinformation and also clarify who is now able to get a COVID-19 vaccine. Of course, this is all optional. Governor Josh Stein said, if you don't want to get it, you do not have to. But we do have a list of conditions that if you have one of these, you no longer need a prescription from a doctor to have access to the COVID-19 vaccine. That includes, it's really a broad list. It includes obesity, asthma, diabetes, physical activity also listed on there as one of the things. Any type of cancer, I'm really seeing lung disease. So quite a few things on this list if you want to go explore that. It also applies to people 65 and older. Any people 65 and older, you do not need a prescription. You can just go to the pharmacy and get your vaccine there. So that's some interesting information from the governor's office, similar to what some other states are doing. So it'll be interesting to see if even more follow after this. We've got some more headlines to get to in our next 20 minutes or so, but we're going to go ahead and take a quick break. We'll see you right after.